Hello everyone, we are trying to take some initiative to spread awareness about virus COVID-19, which is also known as corona. We are making content on coronavirus to spread awareness about this pandemic. For weeks, the World Health Organization resisted declaring the coronavirus outbreak a pandemic, fearing that doing so would incite panic across the globe. But facing the cameras on Wednesday, the agency's Director General, Dr. Tedros Adhanom Ghebreyesus, did just that, asking for global unity to change the course of this pandemic. It was a symbolic moment that underscored the standing of the WHO as the world's leading public health agency. But it also reflected the WHO's underlying weakness as an organization that by international treaty is supposed to lead and coordinate the global fight against coronavirus, yet that has, in many ways, been marginalized. Global solidarity has been noticeably absent in the fight to stop an outbreak that has already killed more than 4,300 people and spread to more than 110 countries. No one seems to be in charge. There doesn't seem to be a plan. 15 years ago, the World Health Organization undertook a major revision of the international health regulations, the global framework for responding to outbreaks. The revision was intended to correct flaws in the global response to the 2003 SARS outbreak, which killed hundreds of people and pushed advanced healthcare systems to the breaking point. One of the biggest challenges we face is that too many affected countries are still not sharing data with WHO, Dr. Tedros said last month. He has also blamed some countries, he has refused to specify which ones, for failing to take the outbreak seriously enough. As part of the United Nations, the WHO is broadly influential yet hampered by budget and political pressures. It lacks meaningful enforcement authority, creating a telling power imbalance. It is often accused of kowtowing to its donors, from powerful players like the United States and China to private funders like the Gates Foundation. These contradictions contributed to the agency's much criticized response to the Ebola outbreak in West Africa and led some scholars to question the need for such a weak institution. But Rebecca Katz, a scholar at Georgetown University, said such criticism misses a fundamental point. If there wasn't a WHO, you'd have to invent it, said Dr. Katz, who has studied health regulations for more than a decade. They are in a bit of a tough spot because you have international law, but then you also know that every nation is sovereign, she said. This time, some former critics credit the WHO for doing a better job, declaring a global emergency much quicker than it did during the SARS and Ebola outbreaks, consistently sharing information with the public and convening more than 300 scientists and research funders to help develop tests, vaccines and medicines. The loophole was the product of hours of negotiations in Geneva, where the revisions were finalized in 2005, according to Gianluca Berci, who served as the agency's legal counsel for 11 years. Mr. Berci said negotiators stayed up until 5 a.m. before agreeing on a trade-off that balanced public health considerations and the retention of the ultimate political power. Countries were reluctant to cede total control to an international agency. They drafted a provision that gave them the right to take health measures that they believed would have similar or better results than WHO recommendations, on the premise that these measures were scientifically grounded and for the common good.
Thanks for watching. To stay updated about pandemic COVID-19, subscribe to our channel and press the bell icon.